As we gather at this extraordinary space for the occasion of honoring our luminaries in the fight against cancer, it is appropriate that we are here in ancient Egypt. Standing before the Temple of Dendur, I'm reminded of the researchers 100 years ago who were unearthing secrets and the excitement of looking upon these antiquities for the very first time in 3,000 years. Tonight we gather here with the same spirit of discovery that they had in science and in medicine and in archaeology that was present in the 1920s. This is indeed a time of great excitement and anticipation about the knowledge that lies just beyond current understanding, but will soon be reached due to all of you being here this evening. In the last 15 years, there has been more progress and more life-prolonging treatments, even cures, than have been discovered since cancer was first diagnosed. And in case anybody is interested, that was 4,600 years ago, and ironically, it was done in Egypt.
And it is really my privilege and pleasure this evening to introduce Leah Khan, the inspiration and the driving force behind Hope Funds. Leah.
Thank you all so very much for being here. So it's sort of my role to talk about the mission of the Hope Funds. So you have these brilliant young scientists who are right on the brink of making their most meaningful contributions to science and to cancer, which could possibly lead to cancer therapies, are really being sort of cut off and eliminated from starting their careers. So what you're doing is extraordinarily important. This type of philanthropy is allowing these scientists to continue. And something Jackie Egan actually asked me to mention was that she said, you know, we only picked 3 candidates this year out of a pool of 200. So these are the best of the best, these young people that you're helping fund. So what you're doing is amazing, and thank you so very, very much.
Our 2009 honoree for basic science and my fellow Hope Funds Advisory Council member, Dr. Robert A. Weinberg. For nearly 40 years, Dr. Weinberg's laboratory has been at the leading edge of every major conceptual breakthrough in cancer research. Ladies and gentlemen, Robert A. Weinberg.
I have the honor today to introduce Phil Sharp. Phil, in 1974, made a fundamental discovery which really has changed the whole landscape of molecular biology by discovering the genes are not one contiguous stretch of DNA, but rather are patched together from various segments of DNA in different parts of the genome. And this has had a profound effect on molecular biology in the years that followed. And not being content with that, having received, by the way, the Nobel Prize in 1966 for this discovery, he went on to become the chairman of the Department of Biology at MIT, and the chairman of the director of the MIT Cancer Center, and then the director of the Neuroscience Center at MIT, the new one. And he then received the National Medal of Science, and all the while conducted an active and cutting-edge research program. This is someone who's had 5 careers in one lifetime, and someone who really should be the object of our admiration, and we're really honored to have him in our midst today.
The personal nature of the wish to end the loss of loved ones to cancer has recently been made clearer to me as several close friends have been diagnosed with really deadly cancers. There has never been more reason for this hope as new treatments are emerging from academic and private labs almost daily, and new modalities such as immune approaches to cancer are emerging and proving their effectiveness.
Is a breast cancer treatment called Herceptin. It has demonstrably saved many thousands of women's lives, and it will continue to save many more thousands of women's lives, and it has changed the field of breast cancer treatment enormously. And in the years when Genentech was being a little bit cautious about whether they were going to bring this drug to market, Dennis Lehman played a role which has been described as brilliant, tireless, and also, I think, stubborn and confrontational. But he got the drug on the market. And I get back to what I said before. It has saved thousands of women's lives, and it will continue to save more. Ladies and gentlemen, Dr. Dennis Lehman.
So I sit with several connections to the Hope Foundation, but the last thing I want to leave you with is what you do could take a fellow like myself, believe it or not, at one time I was one, and we could not get funding from any of the standard funding agencies, and it was philanthropic money that made our journey, that ultimately led to a drug that was approved worldwide, a possibility. So thank you for what you do. Thank you very much.
We are here because of Dr. Sledge's sensitivity and the humility with which he has served his patients for the last 30 years. If personality is an unbroken series of successful gestures, then there's something very gorgeous about George Sledge.
During my career as a medical oncologist specializing in the study of breast cancer, I've borne witness to several transformations in our field. Cancer, in a very few decades, has progressed from therapy dominated by local control measures such as surgery and radiation to nonspecific and frequently toxic chemotherapies to an era of increasingly sophisticated targeted therapies. Dennis Slayman, also honored here tonight, has been a champion of such therapies. We are now, I think, on the cusp of a new era, one that someday soon we hope may bring the cancer story to a close.
Ladies and gentlemen, it is an extraordinary privilege to introduce Mr. Gary Jobson as the recipient of this year's Hope Funds for Cancer Research Award of Excellence in Advocacy. Importantly, he's a stalwart supporter and advocate for the cancer patient and has been the national chairman of the Leukemia Cup Regatta program since 1994. These events have raised over $40 million to date as of 2004. He received the Spiral of Life Award from the Leukemia and Lymphoma Society, and in 2011, the Charles Layton Award for Outstanding Service. In April 2003, exactly 10 years ago this month, Mr. Jobson was diagnosed with non-Hodgkin's lymphoma, and he is cured. I am privileged and proud to present to you Mr. Gary Jobson.
When I took on the challenge of raising funds for blood cancer research, I had no idea I would be the beneficiary of the research. When I got diagnosed, I told the folks at the Leukemia and Lymphoma Society, well, at least when I go to an event, I won't have to have a patient there to explain it. I'll be able to do myself. Well, anyway, you never know what is going to happen in life. But one thing that I've learned is that when you help other people out, whatever the cause is, in the end, the person that is helped out the most just might be you. And anyway, that's my story. I was glad to help others out. I am more than grateful to receive Rituxan and the other technology that came along with all this research so I could be here with you tonight. Thank you very much, everybody.
So it really gives me a great pleasure to introduce the chairman of our board, Dr. Malcolm Moore. We first met Dr. Moore when he received our 2008 Award for Clinical Development for his innovative work that laid the foundation for the development of the drugs Neupogen and Neulasta, which have dramatically improved the outcomes for countless cancer patients. He is currently pioneering a new field, that of cancer stem cell research. Dr. Moore served on our Scientific Advisory Council for several years, and in December 2012 was elected Chairman of the Board of Trustees of Hope Funds for Cancer Research. Malcolm.
The Hope Funds has got a tremendous from my perspective, a tremendous value because it is an organization that focuses on supporting the best and the brightest of our clinical fellows. But if anybody can do it, it is the best and the brightest that we have accumulated here, that we have supported, and that we will continue to support. And for that, I would like to thank all of the individuals who have contributed so much to the Hope Funds. And I would also like to personally thank Leah Khan because of her efforts, her tremendous efforts. She is the driving force of this organization, and I just have so much admiration for her effort and what she has achieved.
To quote a former honoree, Craig Mello, Nobel laureate, he said the fact that we have the tools to advance this science and we don't have the funding is unforgivable. So what you're doing is amazing, and thank you so very, very much.